About half of our heart failure patients have preserved left ventricular ejection fraction. Even when these patients are stable and well compensated, exercise intolerance remains a significant manifestation of their disorder. In the first paper I want to talk to you about, JACC and colleagues report on the effect of endurance training on the determinants of peak exercise oxygen consumption in elderly patients with heart failure and preserved ejection fraction. They evaluated the effect of 4 months of supervised endurance exercise training in patients with a median age of 69. This was not marathon training. During the study, however, exercise intensity did increase from 40% to 70% of heart rate reserve. The investigators found that peak exercise VO2 was significantly increased in those patients undergoing exercise training compared to 19 control patients. The main new finding of this study was that the increased peak exercise AVO2 difference was the primary contributor to the increase in exertional capacity rather than an increase in peak exercise stroke volume or cardiac output. Thus, in elderly patients with heart failure and preserved ejection fraction, peripheral mechanisms such as improved microvascular and/or skeletal muscle function are the major contributor to the improved exercise capacity that comes from endurance activity.